Well, friends, welcome to today's session, and today we will be discussing the learning SLOs for hemodynamics. And our panelist is Dr. Bindu Rani. She's an associate professor in Vijayanagar Institute of Medical Sciences in Bellary.
Bellary, sir.
Yes.
Okay, I'll start off, sir.
Yes, please do.
Yeah, good afternoon. This is Dr. Bindu here. Firstly, I would like to thank Dr. Sanjay for helping me out in my first trial attempt at such a webinar presentation. I may make quite a few mistakes, and this is my first attempt at SLOs also, so kindly excuse me. The topic is on hemodynamics, and though according to MCI there's only 5 competencies, I have split them up because they're too heavy into 9, and the short forms I have highlighted them as case-based discussion, and SAQ is short question, short as essay questions, and SDL for self-directed learning. The first table enlists all the competencies that we are supposed to be dealing with under hemodynamics. Sir, I would like to go to the first competency, which is in the next page. Sanjay, sir? Yeah, it's in the next page. Yes. I'll directly go to yes. So the first competency is the student must be able to demonstrate knowledge of the causes, pathogenesis, types, effects of edema, and the clinical significance. So in this, our first SLO would be they should know the terminologies about hydrostatic pressure, oncotic pressure, and definition of edema, and also must be able to enumerate the 4 to 5 causes of it. So for this, I thought short group discussion would be sufficient, and the assessment method would be short essays or viva voce. And in this, if we wish, we can take it as case-based discussion, getting our colleagues from clinical side, either medicine or surgery, to present either a case that they have and then highlight the clinical points which the student needs to know, making them aware of the situation, as in a nephrotic syndrome or with pedal edema or periorbital edema, or in a pregnant female in 3rd trimester with pedal edema. So these are the conditions which I thought we can take it as case-based discussion also. Second would be enumerate the classification of edema. In the entire competencies in all the SLOs for classification, I have chosen self-directed learning as the method, because classification is just the person has to know by heart what the classification is, so the student can be allowed to go through it by themselves, and then we can assess it either by MCQs, viva voce, or short essay questions. Going to the third important SLO, which is the pathogenesis of edema. For this, I would prefer either a video demo or an interactive lecture, where the in-depth understanding of the subject has to be imparted to the student. And there are some videos which are like games, wherein there's a flow chart and you can have fill in the blanks, like what comes after this step. If the student is able to tell it, that would be an interactive session, and that would be much more interesting to the student if we can give them as assignments. I have
anybody would like to
add
at this? Please raise your hands. Yes, Dr. Shagufta. Please unmute yourself.
Good afternoon, sir. Good afternoon, Dr. Bindu.
Yes.
Good afternoon,
Sir,
ma'am.
second SLO, enumerate the causes of edema, explain the terms hydrostatic and oncotic pressure. I mean, there are also other causes as well. Why we enumerate and explain if we can make it and remove hydrostatic and oncotic, because that will take care of all the 4 categories. By putting
Okay.
only 2 categories, then we are not including the renal causes and other things in causes of edema.
But first they have to understand what is hydrostatic and oncotic pressure and then go to the causes of edema. Until they know what the basic is, I thought they wouldn't be able to go ahead with the other causes.
That will be taken care in pathogenesis, pathophysiology or pathogenesis, that you put as a separate
Separate
SLO.
Okay, ma'am. Okay. Okay, I'll make that change.
I'm making.
So,
So
ma'am is
from
saying,
from here to here.
huh.
Okay. Then we can have the other causes as well.
I mean, I
in the
want them to
pathogenesis.
know all the causes. They should know all the causes,
Yes.
even including the renal causes of edema.
Yes, ma'am. That's right. All the causes of edema, that's there. Enumerate all the causes of edema based on their etiology.
So,
Yes.
Okay. And this part will include physiology, which can be taken as a revision, either taking their help or we ourselves, pathologists ourselves, can deal with the topic. And method of assessment would be again short essays, or as I said, a flow chart can be given in which they can fill in the next event which is supposed to occur. That way they'll be knowing all the steps. That is my understanding. And what has been highlighted in yellow is usually dealt with in practicals. Though I have written here, I think the last competency, the last SLO on number 9 will be dealing with all the practical part of it. So either we can take it there or mention it here itself. The microscopy and gross morphology. So this we will need to have it as a DOAP. So I have put it in the last section, sir.
Okay. In here, clinical significance.
Yes, that is another one. Clinical significance of edema. Here, I prefer a case-based discussion, wherein a scenario is given to the student and asked to tell us what they understand from the situation and how it's going to affect the patient. Like I mentioned earlier, case of anemia in last trimester of pregnancy, how is it going to affect? That part can be highlighted by OBG or medicine departments in collaboration with them.
Okay. So we will have to create this. I think we will have to elaborate this somewhere.
Okay.
Why we are adding? Yes, please.
Okay, I will write it as a note beneath, sir. As a note beneath. Huh. Yes, ma'am.
Regarding the clinical significance, you said.
Yes, ma'am.
Yes.
Clinical significance of edema. Can we just rephrase it and add clinical significance with correlation to site and morphology? Because site like pedal edema, periorbital edema, and morphology. Can we just make this
more
bit of
specific? Okay.
Yes,
More specific we are. Okay, ma'am.
We can correlate the nephrotic syndrome, we can correlate the congestive cardiac failure edema, and we can correlate other forms of localized such as filariasis, or in case of breast, ipsilateral edema of the arm post surgical. We can discuss all
Surgery.
the
Yes, ma'am.
clinical scenarios in this setting with site and morphology, correlation of site and morphology.
Okay, ma'am. So renal, breast, then filariasis, CCF.
I'm just my experience of how we used to do. So maybe that is helpful. That's why I just
Yes. Yes, ma'am.
Okay.
Okay.
Yes,
Moving ahead.
Dr. Malini wants to say something. Yes, Dr. Malini.
Point by. Am I audible?
Yes, ma'am.
Yeah, just a query on that first part, no, where you put the describe the pathogenesis of edema. So basically, my concept is that it's the stalling forces which form the basis for edema, right? When you're adding on,
Yes, ma'am.
under all that will come renal, your cardiac, everything will come under that, right? So aren't you trying
Yes,
to say
ma'am.
that that's the pathophysiology of edema? And these
Yes,
all
ma'am.
these things come under the basic stalling forces. So all you've
Yes,
got to
ma'am.
do there is just describe the basic stalling forces in addition to lymphatic obstruction. That's the only other thing that comes beyond your stalling forces, right?
Agreed,
Yes.
ma'am.
Do we need to confuse them with adding all the renal, cardiac, etc.? So I think it should just remain as pathophysiology of edema with elaboration of stalling forces. Wouldn't that do in that particular column? That's what I thought.
It
I
is
mean,
just
can
as
we- Yes, please continue.
Yeah, it is as pathogenesis of edema, ma'am. As you said, the crux of the issue is just Starling forces. To know or to be able to explain Starling forces, they should be able to define what is hydrostatic and oncotic pressure. But also they should be able to tell the pathogenesis leading to renal and cardiac causes of edema. That they should have at least an idea that they're supposed to know about it. Not that it is a separate entity, but they should know that there are renal and cardiac edema. That's just to make them aware. Not that it is different. Maybe I should rephrase it better.
Yeah, probably.
I will do that, ma'am. I will do that.
Thanks.
Aarti. I think she has some connectivity problems. Anyway, please continue.
Okay, going on to the second SLO, wherein it's a small topic. We just need to know about main definitions of hyperemia, hemorrhage, and congestion. One needs to define them. In that, self-directed learning is more than enough, and if at all you need to give them a better understanding, we can have a short 5 to 10 minutes video demo, or even a interactive play like session. So for this, an assessment method would be Viva or MCQs is sufficient, and we may involve the medicine and surgery units, departments. Can we go to the next page, sir? In the next SLO, we will be describing the special features of congestion of liver, spleen, and lung. This part can be again dealt with in practicals, as I mentioned earlier. All the yellow highlighted ones need to go to the DOAP section in the last SLO. So, any changes here? Any additions here?
Ma'am, should they not know the difference between hyperemia and congestion?
Yes, yes, yes. So, would you want me to rephrase it as define and differentiate
Define.
hyperemia?
Right, ma'am.
Define
That would
and
be better,
okay.
ma'am. Because they have
I'll
to
do
know the
that.
difference between oxygenated and the cyanosis and red erythema.
Yes,
So
yes, ma'am.
what?
Arterial and venous stasis, the difference.
Yes.
Okay, ma'am. I will do that. I am not able to edit right now. I will make the changes and send it across later.
No problem, ma'am.
Just speak. I'll write.
Sir, I will make the changes, sir.
Okay, you have noted. Okay.
Yes, ma'am. Yes, sir. I have noted it. I'll make the changes. We'll move
Describe
to the
the-
next SLO. That
Yes.
that will go to practicals, sir. So the
Okay.
next SLO is define and describe the normal hemostasis and demonstrate the knowledge of causes for abnormal hemostasis. And this, the first thing the student needs to know is the definition of hemostasis and the components of virtuous triad. Here, a case-based discussion or a small group discussion is sufficient, and we can assess the student either in viva voce or short essays. And again, same thing, medicine, surgery, and physiology can be roped in. If at all you're going in for a case-based discussion. We can club the next one also with it, wherein we need to describe in detail immediate response of vascular system to injury, which has the acute phase and the next immediate phase. That part can be explained better in animated videos. So if we can incorporate videos in our lecture, that would be nice. And the same thing, assess them on short essay questions. The third
Okay.
SLO would be, yeah. Any inputs, any changes suggested?
Can I say something?
Yes, ma'am.
Yes.
Sir, regarding the, I mean, you're not including hemorrhage. It's an important thing. They should know different types of hemorrhage and correlate it to site and size, petike, diagnosis, and all
Hemorrhage
that.
is the previous SLO, ma'am. It is in S2. I mean, sorry, 5.2.
Did you include it?
Yeah, define hemorrhage, hyperemia, and congestion, ma'am.
Yeah,
And
but that is only
differentiate it.
definition, but that does not tell them the outcome of hemorrhage. For example, there is hemorrhage into the subcutaneous tissue. This has not much of
Contusion.
clinical.
Okay.
But if there is
Okay.
hemorrhage into the brain, it is serious. So there has to be correlation with size and site. For example, an aortic aneurysm. So these are important things that they have to be oriented with for their clinical life. So I think there should be some addition to the hemorrhage part in correlation with size and site.
Yes, ma'am. So I will phrase it as correlate hemorrhage with respect to
Different
site
types of
and
hemorrhage. Different types of hemorrhage in relation to size and site.
yes, ma'am. Okay. Yes, ma'am. I have added that. I have added that, ma'am. To the second SLO, I have added it. Not here. Sir, I have added it in the second SLO because it has only 2 topics. I have added it there. This is lengthy. This is a bit lengthy.
Okay.
Normal hemostasis is a bit
Okay.
lengthy. So, yes. So the third component of the third SLO is the student should be able to enumerate 5 causes, at least 5 causes of hypercoagulability syndrome, because that plays an important role in the virtuous triad. It is one of the main components. And though the student may not go in depth about hypercoagulability syndrome in the second phase itself, but knowing the components is important as it has clinical relevance with respect to OBG and surgery, especially as in postpartum thrombosis, then post-surgery thrombosis. So these I have included as case-based discussion in my case-based discussion PowerPoint. Hopefully we'll be able to attempt that also if time permits. So 5 causes of hypercoagulatory syndrome is sufficient, I feel, and SDL is enough, as they just need to know the names, and we can assess it based on viva voce and MCQs. Describing the coagulation pathway is going to take a lot of time, and it needs a proper detailed explanation. So small group discussion or an interactive lecture Using more of flowcharts is necessary or videos to demonstrate it, and we can assess it based on short essay questions or MCQs. Sorry, flowchart. And coming to the next component, we have to be able to, I mean, the student has to be able to enumerate and explain the functions of the components of platelets involved in hemostasis. We are trying to cover all the three points of Virchow's triad. So functions, normal functions of platelets and the components of platelets, if the student is able to enumerate, they will be able to even write the answer for pathogenesis of thrombosis, which will be our next SLO. So basis is formed here itself. And the next component is the student must be able to classify thrombi based on time and site of formation, and should be able to list 4 differences between the 2 types that he is enumerated. For this, self-directed learning or small group learning is sufficient, and we can again assess the student based on MCQs and short essays. Any inputs, please?
Dr. Barnick. Dr. Barnick, can you unmute yourself?
Yes, sir. Good afternoon. I feel there's a lot of overlap with this bleeding and platelet disorders in this SLOs of yours. Also, coagulation pathway would have been covered in physiology already. So, detailed discussion on coagulation pathway is not necessary. Just a brief recap or a correlation should be sufficient at this moment.
Sir, what we have seen, even though they have learnt it, they just know the and the flow diagram, but they do not understand the significance. So we should be able to explain a little bit as to how it matters, what positions are present in, why calcium is needed, the phospholipid is required. Okay, we can take it as, but still that has to be reinforced, I felt. That's why I do have written that we need to take either physiology or we can do it as well. Either the help of physiology department or do it as well.
Because this
You're
in
right.
CBME we are supposed to reduce the overlap between
Number of
competencies in various subjects.
Yes.
If we are still
So we have
Okay.
to make sure in the first prof itself, we agree there in the first there should be some vertical integration of this.
Okay.
We
right,
have
right,
to
sir.
So
physiology.
Physiology,
so wherever
some sort of vertical integration would be required in a first prof itself. Right, sir.
Yes.
okay. Okay, so how do we merge this, sir? Then do we take it in the beginning class itself, where we are giving an intro to hemodynamics and tell them that these are things that you need to
Yes, you tell
brush.
them beforehand. Yes,
Huh.
and also contact your physiology people that they have to do some vertical integration with pathology beforehand.
Okay.
Right, sir.
Okay.
We have to, there has to be some temporal integration and some with physiology people, and
Okay.
we stay in contact with the other departments
Okay.
proactively.
Okay, sir.
Yes.
Okay.
Just
So
need some change.
yes, sir. So this part, describe the coagulation pathway, can be just assessed and not taken as a class. Maybe we can club it with something else and then can be just assessed. Can we do that?
Yes, we can assess that. Yes, we can assess
Yeah,
that in
we
the
can.
Okay,
formative
thank you.
assessment.
Yes,
Okay,
that would be
thank
good.
you.
Yes, sir.
Formative assessment. Okay. So coming to the next SLO, that is 5.4, demonstrate knowledge of the causes, mechanisms, and effects of thrombosis and the clinical significance. So here the student
Yes.
should be able to define thrombosis and enumerate its causes, all the causes. So again, I would prefer a small group discussion for this, and the method of assessment would be viva voce or MCQs. A vertical integration with medical or surgical units departments can be taken. If there are cases in their wards wherein there is a DVT case from surgery, we can have actual live case demo, and then the student would be better able to understand the clinical scenario. And second component of this SLO would be to explain the effects of altered flow in vascular system. This this we would prefer to do it in a case-based discussion, interactive video lecture, because the video will show these new animated videos will show how the damage occurs and how the platelets come and form the primary plug, and then how the coagulation pathway takes place. Everything comes into picture there itself. So the overall view can be given in this component of this SLO. This is my understanding. If there's any changes, please suggest. I would prefer a video demo for this, wherein effects of altered flow, that is a narrow, where there is narrowing of the vessel wall, where there is widening of the vessel wall, what happens due to turbulence. All this can be better shown in a animated video, which are available on YouTube.
Yes. Dr. Vijay Shri Raghavan.
Yes, sir. Good afternoon, sir. Good afternoon, ma'am.
Good afternoon, ma'am.
Can I give small suggestion here regarding the effects of altered flow in the vascular system? This can be dealt in the previous session where we are starting with varicose triad.
Okay, hemostasis and varicose triad. Okay, ma'am, because that SLO is quite big, ma'am. Like we have 4 to 5 components in that. Actually, I split the thrombosis part into normal hemostasis and abnormal component. I have tried to divide it as much as possible, but there is an overlap. I am not able to have it completely segregated.
The continuity will be there when we discuss along with the varicose triad, because it's easy for the student to understand all the components of a formation of a thrombus.
Okay,
so the next SLO also, the describe the pathogenesis of thrombosis, again an overlap, because we are going to already tell them everything
yes,
in detail.
Yes, ma'am. Yes, ma'am.
And madam, I had one more doubt as well. Hello, in your hypercoagulable state, we should make a mention of antiphospholipid antibody syndrome, because that is very specific for OBG scenario.
Yes, ma'am. Okay. As in clinical conditions, yes, that does come, ma'am. Yes. Okay. APLA, I am going to write that. Okay, ma'am. With special reference to APLA, I am going to write that, ma'am.
Yeah. Thank you. Thank you so much, ma'am.
Thank you, ma'am.
Okay. Anybody else?
So,
yes, please continue.
Yes, sir.
So the next.
Next component is enumerate the different types of thrombus and enlist their differences. This can be an SDL, not necessarily an interactive lecture. This just so that the student is able to better understand. If they have any doubts, they can come back to us. regarding this, but this can be an SDL, and we can assess it based on viva voce or MCQs or short essay answers. And the last component is quite important, where we discuss the clinical significance and the fate of thrombus. So the fate of thrombus and the resolution part, the increase in the fibrosis or progression to embolus. These things need to be discussed. Sir?
No sound. Yes, please.
Okay. So taking a case-based scenario would be good in this situation, because the student will be better able to understand the clinical effects than just a verbal discussion. Any changes, any inputs, or shall we move on to the next component?
Ma'am, will you be discussing emboli, different types of emboli in the next one, infarction emboli?
Yes, ma'am. Yes, ma'am. Yes, that's what I said, that I have broken down them into multiple SLOs, because clubbing them would be a little bit too much for us to cover, and the student will not be able to understand. So next SLO would be on embolus. Yes,
Can I
ma'am.
interrupt, madam? Sorry,
Yes,
madam,
ma'am.
again. This is regarding a special emphasis on the difference between systemic thromboembolism and pulmonary thromboembolism. Are we going to discuss that earlier itself?
Yeah, I have written enumerate the different types of thrombus. It can be antemortem thrombi, postmortem thrombi. It can be arterial thrombi, venous thrombi. The different types, and then you also enlist why they are different, how they are different, and clinical significance will be. I'll add that term. Explain the clinical significance. Do I say explain,
yes,
or do I? Okay. Explain the clinical significance. Okay.
Yeah, thank you, ma'am.
Thank you. Thank you so much. Okay, so coming to the SLO 5.5, wherein we are asked to demonstrate knowledge of causes, types, and effects of embolism and the clinical significance. First component would be to define and enumerate the causes of embolism. A case-based discussion. I have felt that if you can give movie scenarios or real life scenarios, it would be good to catch the attention of the student. I have usually started off with movies like Vertical Limit, wherein there's snow and there's avalanche, and then how the temperature falls and how there's pulmonary shock and edema. So these conditions, if we are able to, these examples, if we are able to tell to the student, there will be a little bit more interaction than just rote lecture. So case-based discussion and small group discussion is what I would prefer for this, and we can assess the student based on viva voce and MCQs. Here, even ortho, because fat embolism in fracture cases comes into picture, amniotic fluid embolism and pulmonary embolism comes into picture with respect to OBG cases and surgery cases. So we do need vertical integration in this scenario more so. The next component would be to classify embolus and enlist differences. I think, sir, you have typed clinical significance for embolus. That should have gone for thrombus here in the second component. I am making the changes on my laptop, sir. I will send it across to you later.
Okay.
Yes, sir. So for classification and to know the differences between embolus, I think self-directed learning is more than sufficient, and to assess them, MCQs would be good, or viva voce. Rather, match the following we can take as one of the assessment methods. And now coming to pathogenesis as such, this will be a component of thrombosis itself. Only a little bit of extension has to be mentioned here. So we can take it as a continuity and need not have to spend more time on pathogenesis of embolism per se. It would be as such a extension of fate of thrombus. That is my understanding. So this can be assessed as short essay question or MCQs. Any changes that I need to make here? Okay.
Tejas Choksi. Yes, Dr. Tejas, please unmute yourself. You are self-muted, Tejas. Tejas is unable to unmute. Tejas, you can write in the WhatsApp group. Please continue.
Okay, sir. Next component would be a special note on decompression sickness. Not only is this interesting, but quite severely affecting disorder. So this needs to be dealt with in detail, and a video demo of situation how badly barotrauma can affect. There are many videos which show that how the decompression chamber is there and what suits they're supposed to wear. This will be much more interesting and interactive to the students, so we can use those video demos to make them understand about decompression sickness. Short essay questions can be used for assessing their understanding in this, and medicine and surgery. I think basically surgery department is needed here. And finally, describe the clinical significance of embolism. Here, all the clinical scenarios that you have utilized till now, either a female post-pregnancy or a fracture case, fracture of femur case, or we can take a scuba diving case. All these case scenarios can be used here to enumerate or elaborate on the clinical significance of embolism. And the treatment part for thrombosis and embolism, pharmacology can be a horizontal integration. I think pharmacology can be called in to tell about antithrombotic agents. Any suggestions, please?
Good afternoon, sir.
Good afternoon, sir.
Madam, just I want to know that the various types of embolus that we have to take in
Yes,
this.
sir. Sir, there is septic emboli, bland emboli, arterial emboli, then venous emboli.
Okay, so that included, I think, in the classification, na?
Yes, sir.
Because, okay.
You are classifying them, yes.
Okay. Because
yes, sir.
Sometimes they have given the one objective, that is type of embolism. That's why I am asking, I think.
Yes, sir. You need to classify the types of embolism. It is an important thing because based on the lines of Zahn, you have postmortem thrombi, antemortem thrombi, and again, then the very same thing. If it progresses to embolism, that will help you in differentiating whether it was pre-mortem or antemortem or postmortem.
Okay, madam. Thank you.
Yes, yes. So maybe we can even have forensic also included in this, sir.
Yes, I think forensic will be much more.
Yes, sir.
Yes, pharmacology and
yes, sir. Forensic for various types There, I think we can get forensic there.
Yes.
Okay. Now coming to 5.6 object SLO, define and describe the infarction, its types, morphology, and clinical correlation. So the first part is to define and enumerate the causes of infarction, all the various causes of infarction. A case-based discussion or an interactive lecture is needed in this, and we can assess based on MCQs or viva voce. Here, medicine and surgery departments can be involved. Second part is to classify infarcts and discuss their characteristics. There are various kinds of infarcts. So that part the student needs to know it clearly, because based on that many viva questions are asked and your short answers. So this part can be for self-directed learning, and this should be a little bit more guided than our previous competencies. Method of assessment is short essay question, MCQs, and viva voce. Describe the pathogenesis of infarction, wherein which is same as ischemia. Here you can take a case-based discussion as in MI, and how it progresses over time based on few minutes to few hours, then progressing to days, how the thrombus or infarct changes over days. So that part can be dealt with in detail. Can be assessed by short essay questions, MCQs, and viva voce. Clinical significance of infarction. I was thinking with respect to splenic infarct. You give a case scenario wherein a young child comes with multiple infarcts in the spleen. So you are correlating it with respect to hematology also. So I was thinking of that case scenario and how it affects spleen. So can this be taken as an example? Just for spleen.
Yes. Yes, I think, and we can have some, as you say, with the medicine and surgery.
Yes, sir. Yeah, because infarct again gives rise to gangrene. So that will be the consequence of ischemia infarction with associated or not associated infection. Then it goes forward gangrene. So that will be my next SLO.
Okay.
Okay, and in this, for describe the clinical significance, we shouldn't forget the factors that influence infarct formation, like depending on the blood supply of the organ, whether it is dual supply or mono supply, and whether the it is a solid organ or a spongy organ, whether it has end organ supply or end blood supply. These factors I need to add that. I will add it to clinical significance. Factors that influence infarction. That is one point which I have missed. I just recollected it. I will add that. Coming to next SLO. Sir, if you can move it to the next page, sir. I will add it, sir. I will make the changes and forward it to you.
Okay.
Okay. Define and describe gangrene, its types, morphology, and clinical correlation. The first thing is define and enumerate the causes of gangrene. In this case-based scenario or a small group discussion is sufficient, and we can assess the student based on short essay questions or viva voce. And surgery can be surgery department can be asked to help out in this scenario. And the next topic is enlist the types of gangrene and enumerate the distinguishing features. Like as I already mentioned, dry gangrene, wet gangrene, and gas gangrene. So all these three need to be enumerated in detail. The student needs to have, if it's better if we have a clinical presentation, if we have a case, they will be able to understand it better in clinical context. So small group discussions or tutorials are needed for this, and Viva was say short essay questions or MCQs for assessment method.
Okay.
Okay. And pathogen.
Ramachandran wants to say something.
Yes, sir.
Thamil Salvi Ramachandran, you have raised your hands. We can't hear you, Dr. Ramachandran. Dr. Shufta. Please
Sir,
unmute your, yes.
Sir, I just wanted to say about this SLO gangrene, that they will be taking this part of this SLO in cell injury. So isn't it a repetition? Isn't it going to be a repetition? Can we just make it concise? And it's okay, even if it is a competency mentioned by MCI, we can always write there that it is already taken, and we can take some part of it here which has not been taken there.
Ma'am, gangrene, I haven't come across in cell injury, ma'am. At least
Sir, it is dealt in cell. What I know is dry and
yes, some part of it is there, yes.
So that will be again redundancy. Our effort should be to avoid duplication and redundancy.
Definitely, ma'am. If it has been covered, I have missed it. And in that case, yes, I think we can just discuss the, refresh the pathogenesis of gangrene, the types, and then with special concentration on gas gangrene and describe the clinical significance. I think the last two components would be.
Or you can give them a case which can help them to refresh on their own. I mean, we are not going to teach them again and again. They have already taken, and leave them to do the case in the SDL. You can give it as an SDL to them and just go and supervise them once or twice and just leave them to study and revise what they have already learned. But what is left from that, you can take as a new SDL here.
Okay, ma'am.
New or new SLO here.
Okay, ma'am. I'll look into that. Yes, ma'am.
Dr. Dost Muhammad Khan. Dr. Dost Muhammad, please speak. You can type in the WhatsApp group also. Yes. Dr. Umarani has also said in WhatsApp group that gangrene is dealt with cell injury. Dr. Dost Muhammad, we can't hear you. So I think we can continue.
So the next page, sir.
Yes.
The next page. Okay. So the next SLO is 5.8. Define and describe shock, its pathogenesis, stages, and clinical correlation. Now, depending on your approach, I think this sometimes may need to be split into two classes because septic shock itself takes time and DIC by itself is a class. Now, if you want to put DIC under hematology, then the rest of the topics can be dealt here. But if DIC also is going to be covered here, then we need to split this shock into another SLO. Coming to that, define and enumerate. Yes, sir.
DIC is always covered here.
Yes, sir. So sometimes few teachers ask us to Just leave it as it is dealt with in hematology sometimes. So I wanted to know. I mean, coagulation system.
Yes.
Okay. So define and enumerate the cause.
Yes.
Okay. Define and enumerate the causes of shock. Small group discussion, case-based discussion. If we can give a good case so that the student is interactive, and then assess the student based on short essay questions and viva voce. Here, medicine, surgery, and OBG departments can be roped in. Classification. I think only SDL is sufficient for classification. I have made a mistake there. I think it's been copied wrong. Only SDL is sufficient for classification of shock. And method of assessment is viva voce or MCQs. And next component is to describe the pathogenesis of shock with special reference to septic shock, because cardiogenic shock, neurogenic shock are also components of various types of shock, though they are small, they take up small amount of time. But that flow chart which is given is good, and I think we can utilize that to make the students understand better. And case-based discussion or a lecture is the method of teaching here. And DIC, I would put it under next component, as septic shock and DIC together is not possible. And viva voce, short essay questions and MCQs can be used as method of assessment. Then the various stages of shock and clinical significance, we can take a clinical scenario where you explain a mild shock, give an example of a mild shock where a person receives a bad news, and that is, we also call it a shock where the person is unable to respond, that is emotional shock or a neurological shock than a neurogenic shock. Then you come to an accident area where the survivors are present, and that is another clinical scenario. And one where there is actual loss of blood or actual discrepancy in cardiovascular system and the requirement, where our definition fits in. You give them 3 different scenarios and tell how they are supposed to assess each case. I think that would be a good case-based discussion. I am not very good at putting it across. This is my first attempt, so kindly excuse me. If there are any mistakes, please do correct.
You're doing with no issues.
Thank you, sir. So, yeah, small group discussion or a video demo, and assessment method would be short essay questions.
This is an additional which you have made.
Yeah. Yes, sir. Yes, sir. I have to thank Shagufta ma'am for her detailed presentation. So from that, I have taken it on to our scenario of hemodynamics. So if we can open the PowerPoint, these are the clinical scenarios. I'll just explain. For hemorrhage or congestion, we can give a situation or a station wherein there is a patient of blunt injury, or we can ask them to reflect on their self-experience of finger prick.
What is the title of the PowerPoint?
Sir, SLO hemodynamics cases, sir.
Just a moment.
Yes, sir. SLO cases I have written, sir. So we can have gross specimens from our museum or printed images of the very same for congestive chronic venous congestion of different organs. And we can also have a photomicrograph if we have slides, that's well and good, or we can have photographs of the very same. And thrombus and embolism, we do have cases of aorta and renal vessel thrombosis. and give them clinical scenarios. Yes, ma'am. Give them clinical scenarios wherein there is embolus in the aorta or in the renal vessels, and special mention about retrograde embolus, how it happens or why it happens, giving a clinical based scenario, and showing them scan images of resolving thrombus, which would be very interesting to the student to see that a completely obstructed vessel is now resolving either due to thrombolytics or due to stenting, the changes that take place, and the significance, clinical significance of their clinical management. This can be highlighted here. Same with infarction, gross museum specimens and glass slides if you have. Infarction, spleen, kidney and heart. And infarct is a very good gross specimen because the wedge-shaped infarct with the color change is so evident that the student, it hits the student in the face and they should be able to pick it and not miss it at all. So this, I think we should work on. And the changes that are seen on the serosal aspect. Yes, sir. You're not able to find it, sir. Should I send it again?
Yes, it will be better. Just a moment.
Sir, I've sent it again to you right now, sir. About the case-based discussion, mine is not in sequence. What I mean is, case 1 doesn't follow case 2 or case 3. They're individual cases by themselves. I have tried to fit into a particular diagnosis. So it's not in flow as Dr. Shagufta had put, like progression of the case scenario. Mine is not like that. Mine is individual groups.
It will take a moment to download.
Okay, sir.
Because running a webinar as well as this is taking
Difficult,
some bandwidth, sir. And yes.
Sir, if I may suggest, sir.
Yes.
Sanjay, sir, if I may suggest, just if we can share the cases with them, they can make the changes and give the input.
Dr. Kalpana wants to say something.
Yes, sir.
No, sir. No, sir.
My screen is. Yes, Dr. Kalpana, you want to say something?
Sir, I was just saying that DIC and air
Kalpana, you raise
embolism, they are very... Hello, good afternoon, sir. I was saying
yes.
that DIC and air embolism, they are very important, and amniotic fluid embolism. So it is to be integrated with the gynae department. Amniotic fluid embolism and DIC.
Yes, ma'am. That has been mentioned. Vertical integration with OBG.
Okay. Thank you, ma'am.
Thank you.
I think yes. We can have it with some problem, Dr. Bindu.
No, so we'll just share the cases. That's all. I think you can share the same PowerPoint on, or I'll share the same PowerPoint on WhatsApp group, and they can give their feedback and inputs to us. That would be more than enough. I'll do that. Okay, sir.
Yes. Because I mean there is some connectivity problem right now, and it is not opening.
Yes.
Thank you, sir. For some time, and it's still. So we can do one thing. I just wanted to tell you one thing that I'll be sharing one. Yes, I have just. this another Google form with you.
Yeah.
Submission of SLO and case-based question. So all of you have chosen one chapter in general pathology and one chapter in the 2 chapters in systemic pathology. So all these chapters, they are already written there. You just have to choose one. You just have to choose one. There is a drop down menu here, and there is a facility for file upload here. As a Word document or text file, you can upload your case-based questions as well as SLOs. So,
Yes, sir.
for
Sir,
whatever you have chosen,
sir,
and
you send it.
especially I haven't sent it. I have just created this form so far, and there are some editing still left. But this way, all the SLOs, they will be compiled in the form of a Word file.
Yes, sir.
And you, because different people have written the names of chapters as different. The same chapter, it is written as hematology, it is written as WBC
Right.
disorders, and so here now if the name of chapter is, I have standardized it, it is easy for to search in the Excel file. Somebody has written kidney, somebody has written renal. So I mean, and for 150 people, I mean, this way the search option is available.
Yes.
So, and earlier none of you had submitted the systemic pathology competencies. Now you will submit systemic pathology competencies also.
Yes, sir.
So that we can create a timetable for further deliberations.
Sir, we don't remember what we submitted for systemic.
I will give you the earlier Excel sheet also.
Thank you, sir. Actually, the old emails, they just get deleted when we clear the track.
I every word of which you submitted earlier.
Okay, sir.
Each and
Thank
every
you, sir.
word I have. Yes. And Dr. Sinasan has been helping me with this, and I acknowledge his help. From Pondicherry, he seems another quite savvy in this. Thank you very much, Bindu, and all the participants.
Thank you so much, sir.
Thank you, ma'am.
Thank you.
Thank you, sir.
Okay.
Thank you, sir.
So on Friday, we will meet for the next chapter, that is neoplasia.
Okay, sir.
Either neoplasia or immunology.
Okay, sir.
I don't have anyone for childhood diseases. So somebody must come up for the genetics and childhood diseases.
Sir, actually, the childhood diseases chapter, whatever it includes, it is being taken up by the students in pediatrics. So there is lot of overlap, and I mean, this is one of the redundant chapters that many people across the world have deleted from pathology course because it is being taken elsewhere. Maybe you can look at that dimension, sir.
Okay. I will look into it. And anyone else wants to send any message, you can send. Thank you.
Thank you so much, sir.
Thank you, sir.
Thank you, sir. Thank you, ma'am.
Thank you.